I'm driving across Louisiana today, heading towards Pensacola. Thought I would record a little update. I spent the last 3 days in Houston at a facility in the Texas Medical Center there, and it was interesting because compared to some of the experiences I had on the road coming down through Colorado and through Texas, you can tell that in general the people in Houston are taking things quite a bit more seriously. Even outside of the medical center area, almost universally people were in masks. I know that they've got orders for masks in the city of Houston, and the state of Texas itself just recently instituted that. But I think it was beneficial to see that the public awareness has grown to the point that people are wearing the masks. Hopefully we'll see in the next couple of weeks a corresponding drop in the increase of new cases. That when you think about that you're always going to have quite a bit of lag in that between implementation of a policy to try to suppress the contagion and its effectiveness, because prior, for example, to a person starting to wear a mask around, if they were infected, and then when you go home, you're not wearing a mask at home, so your family members or the people that you live with are going to be subject to infection from you. So you can see how the knock-on effects of kind of being fast and loose with the measures to decrease contagion can take a while to take effect. And the other thing that I'm noticing just as I study the data, excuse me while I stop because there's traffic, while I take a look at the data, there's a lot of talk in the media about the fact that the deaths aren't increasing even though the cases are skyrocketing. And as I'm looking through the data, what I'm seeing on that is that it appears that the largest reason for that is that the cases are increasing most rapidly among younger people, and then younger people are less likely to get hospitalized, less likely to have critical care complications as they contract the virus. So that makes sense to me. And then the other thing obviously would be that there is some lag time. So we're a couple weeks into this latest surge that's been happening throughout the U.S. So whether or not that translates into the deaths increasing is yet to be seen. Now, hopefully it'll stay low. Hopefully, well, relatively low, I should say. But we're about a fifth right now of the top death rate. So that's quite a bit lower than what it was during the time when New York was getting hit really hard. So I imagine that part of that is the anti-inflammatories that are being found to be effective, and other treatments for those critical patients that the doctors are learning more and more about how to treat this effectively and increase the survival rate even among those who have the comorbidities or other higher risk factors for severe complications. So I mean that's all good news. So the other thing that we had heard just today, actually, if I remember correctly, it was in Houston also. Apparently there was a 30-year-old young man, I'll call a 30-year-old a young man, who died in the last couple days. And apparently he contracted the virus, or it appears, you can't guarantee it, but it appears that he contracted the virus by attending a COVID-19 party. So apparently it's all the rage for youths to hold a party, and many times the host of the party is somebody that is confirmed positive for COVID-19. And there's a perverse logic to that. I could see as a young person, it's like, okay, well, let me get it and I'll get it over with, and then I'll be immune. But, in the case of this young person, it cost him his life. So not very smart, I don't think, playing those odds. If you I wouldn't play Russian roulette even if the odds were 1 in 10,000 that there was a bullet in the chamber. Period. Especially when there's no upside, right? There's, it's not like somebody saying, I'll give you $1 million if you pull the trigger on this gun and there's a 1 in 10,000 shot. There's a bullet in the chamber. There's no upside to contracting this virus. It could only cause a downside. Well, not only cause it, but more likely it's going to cause a downside. And that's without even taking into account that there might be chronic effects on the lungs, on the lung tissue and other organs of the body that people who get this virus could be living with for the rest of their life. So no bueno, not a smart move. So anyway, that's me from Louisiana today. As always, try to stay safe out there. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol in it if you don't have access to soap and water, but soap and water is better because it breaks up the virus more effectively. So if you can, do soap and water instead. And it also dries out your skin on your hands less. Wear a mask or other face covering when you're in public places. Recognize the fact that, that doesn't mean you have to live your life with a mask. Take it 15 minutes at a time if you need to. I've said it before, I kind of look at it the same way as I look at scuba diving. You keep the regulator in your mouth and it's uncomfortable and your throat gets dry, but in order to experience that, you need to do it, right? So, and it's the same kind of thing if you need to go out and about, just even if it means that you have to take multiple opportunities to get a job done or whatever, where you have to go in public. I think it's worthwhile doing. And stay safe out there. Tell your friends and family to be safe as well. Thanks.